Yes.
Yes, you mentioned the contract. When is their contract up?
The problem with the contract is it doesn't have a clear-cut expiration. Some of the provisions appear to persist into perpetuity, such as the scope of services and the size of the hospital. There's no clear-cut expiration. Really, the contract is not that well written, in my unprofessional opinion. But there was never a termination date. There was never a time at which Sutter and the healthcare district agreed that each had met the obligations and the contract had expired. So it's an excellent question, and that's going to be a very important part of the litigation. It's unclear. It's going to come down to these arbitrators or the judge of the Court of Appeals.
What if Roger Gittman gets you a spot on Fox News saying that Bill O'Reilly is
I haven't gotten over my public speaking fear to that degree yet. A little more time. Yes, Jim?
So if you're telling me that if the local hospital board says, we want a Sante, that they can terminate the contract and get the Sante instead of Sutter Coast, is that correct?
It could happen tomorrow. That's what's so frustrating. Now, and this is interesting. So I spoke to one of the board members. I won't pick on any names, but I spoke to one of the board members and I said, back when Kevin was on the board, he raised all these concerns about losing ownership of our hospital. What did Sutter say? And the answer I got was, they said, why don't you go talk to Asante if you want to deal with somebody else? Because this is the deal. This is it. We're Sutter. This is it.
Those people live in the town, and there's
Right.
pressure that can be brought to bear on them that doesn't touch Sutter Coast.
Right. But why would you not? And it goes back to Jack's argument. So somebody dies on an airplane or ends up with a $50,000 bill that they otherwise wouldn't have had for the transportation cost. And the board of this hospital did not look at alternatives to that scenario. They didn't even investigate, because look, Sutter's going to come back, I'll tell you right now. They're going to say, Mike Cohill told us this. Okay, this is the president of the region. This is our August 2nd meeting again, the one that the minutes were deleted from. He said, the option we may choose for this community is to go broke and close the hospital. So that's what they use. They use that nuclear option. It's kind of a common strategy with Sutter. They did the same thing in Santa Rosa and the same thing down in San Francisco. It's, it's our way or the highway. But we have alternatives. We've contacted 3 healthcare companies. Asante is kind of the clear-cut choice because of their excellence and their geography and so forth. But there are others out there too. Businesses like monopolies. It's good for business. It's not like we're some terrible place to do business. Yes?
If we go to an acute care facility, do we lose our charity hospital designation? And then what happens to indigent care and who pays for it?
This is a great question. The answer is they still have to see everybody who comes, but who comes to the hospital is going to have to get treatment either here or someplace else. But here's what happens when you go critical access. This is what they did in Lakeside. They realized they didn't have enough beds to treat everybody. So they had a priority system. I believe there were 8 levels of priority for a hospital bed. The lowest level was emergency room patients. So they had the lowest level to get that bed. Elective surgery was higher and outpatient things. So what that means is you're transferring many more people out of your emergency room who tend to have poorer insurance overall, especially in a county like ours or in Lake County. So then all the surrounding hospitals get the message that when Lake County calls, you can expect somebody who may have done some socially inappropriate activity like punch a window or whatever, and they're going to become their patient. It doesn't lead to good physician-to-physician communication. And our emergency room director, Dr. Saunders, who is an absolute saint and keeps this emergency room going despite very limited resources, is extremely concerned about what the impact is going to be on the emergency room, just for that reason. Oh, yes. So the 3 in Brookings now, only 2 of these voted for regionalization. Hall and Jacobson. And then the ones here would be Arshi, A-R-S-H-I, Polidor,